Here's the problem. Every workplace has them. The nuanced tasks, the fatigue at the end of the shift, the injury that almost didn't happen. What if you could build a solution that could change an entire industry? At the Applied Ergonomics Conference, leaders are exploring how AI, wearable technology, and human-centered design are transforming worker health and safety. Welcome to a special episode of Problem Solved, highlighting one of this year's AEC Keynote speakers. IISE's Frank Reddy sits down with Dr. Mark Benden, researcher, inventor of nearly 30 patents, and leader who has helped generate more than $2.5 billion in economic impact through ergonomic innovation. In this conversation, he walks us through the journey from idea to commercialization and why the next big breakthrough might be sitting inside your organization right now. Join us.
I'm Dr. Mark Benden. I work here at the Texas A&M University School of Public Health. I'm also the director for the Center for Worker Health. And I'm a certified professional ergonomist and someone who's been involved with the Applied Ergonomics Conference since the beginning.
Perfect. What do you look to highlight in your keynote address, and what would you hope for attendees to gain from that?
Probably the first thing would be to have a little bit of fun. So I have a few funny kind of anecdotal stories planned from design requests that people have given me over the years that I think the audience will enjoy and probably get a chuckle out of, usually at my expense, of course. There's plenty of flops and foolish things that have happened over the years, and it's always good to kind of share some of those moments with people. Another piece that I'm really hoping they get, and one of the angles that is kind of centerpiece of the talk, is around commercialization. And so how do you take these ergonomic improvements, sometimes they're tools, sometimes they're processes, how do you kind of take them to the world? How do you get them out there? And a lot of people that do this type of work are pretty good at solving problems, maybe, for instance, at their current employer, but they may not realize that that thing could be used by lots of other employers. And so how do you get it out there? How do you take it to the world? So I'll spend quite a bit of time on that. And then, of course, a little bit of just encouragement for everyone there. Some fun and some encouragement.
So you got some experience in the military, in business, and in education. If you want to talk a little bit about how your experience in all those areas led to your role at the Center for Worker Health.
Yeah, it's a long and storied process over 40 plus years, obviously. But I think probably the easiest thing to relate the audience to would just be that I spent quite a bit of my career in my early formative years getting dirty, getting sweaty, getting tired, working in the heat, working in the cold, getting injured, cut, scraped, bruised, burned, you name it. And I think that probably, as much as my formal education has kind of informed the way that I approach trying to figure out solutions for workers. And that was true in the military. It was true, when I was a machinist working in a machine shop. Absolutely necessary to have the types of controls and interventions that we work on so often in ergonomics to try to improve the quality of the outcomes for the worker, not just the parts and pieces that they make. We, of course, have to focus on that as well. It's a business, but we sure love to take care of people and make sure that they're able to go home to their families safely and whole. So.
How would you say that advanced technology is affecting efforts to improve worker safety and health?
This is a really big topic right now that comes up quite often. We're seeing some pretty big advancements, for instance, in monitoring workers. One of the things that used to happen was they would send someone like me out with a clipboard and a stopwatch, and we'd go stand next to one worker for 4 to 6 hours, take a sample of what they did, and we would come back and make claims about that whole area or that whole workforce. And as you know, the science of sampling is very robust, but it's also fraught with problems and bad assumptions. And the advantage today is that we no longer have to really settle for sampling 1 or 2 workers or a small group of workers. We can sample all the workers all the time. We can sample them through things like video systems and smart intelligent systems. We can do motion capture with cameras. We can analyze that data using AI. We can also have wearables on the person. So not only do I have a chance to capture what is happening to the worker, I can also capture how the worker's body is responding in real time. And that is a huge game changer for technology in this field today. one of the big places that we're really heading next, I think, is that we will begin to apply that type of data collection to real-time corrections, real-time fixes, real-time adjustments. Those could be behavioral, right? So Frank, I might say, hey, Frank, in your hard hat, helmet, earpiece, I might say, listen, this is happening, this is going on, maybe you need to try it this way or use this tool or do that, or stop. Hey, don't do that, you're going to get hurt. Whatever it happens to be, it could be real-time technological interventions instead of just what we've done in the past typically is we've collected data and we said, wow, Frank got hurt out there. That's bad. How do we keep Frank from getting hurt again? As opposed to, wow, look at Frank. He's about to get hurt. Let's stop that right now and fix that, in the moment and prevent an injury. Those are big changes that are really just happening daily because of technology. And, like I said, being able to analyze massive amounts of data in real time without AI, without the algorithms that are being written now, we wouldn't have been able to do that before. So very, very exciting times for the field.
Gotcha. It sounds like it. Can you share a few of your patent inventions with us and tell us why you're proud of them?
Sure. Of course, I'm getting close to 30 and a bunch more pending, but one of the earliest patents that I did back in the 90s was an ergonomic armrest that was 4-way adjustable for chairs. And it's hard to imagine today sitting in an office chair and not having adjustable arms because we're all conditioned to that now. But there was a time, and this was one of the first to really be able to provide the height, the width, the depth, the rotation of the armrest. So that was exciting. It was definitely a game changer for the industry. Standing desks has been another one that I'm very proud of, and literally have gone around the world with that for both adults and children in schools, K through 12. Millions of children now are using those standing desks from that original design. And another thing for the office, footrests for standing desks, because I really believe strongly that if you have a standing desk and you don't have a footrest, you're only about halfway there. You really need that footrest to make that comfortable. And then, of course, the most recent one that is having some nice breakthroughs for healthcare is the use of digital humans as agentic agents. And so what I mean by that is instead of doing a chat bot or something like that where you're just typing, this is actually having a conversation with a human-like avatar. And, she's able to walk you through whatever your healthcare problem or challenge is, or help you pay a bill or schedule an appointment, that type of thing. So very excited to see that newer technology getting out there and helping people. In ergonomics, we've applied that to training. So using these agentic agents to do ergonomic training for remote workers, and that has been met with a lot of fanfare and great success.
I'm intrigued because I'm not an ergonomist, but I wonder, I'm kind of like I have a lot of creative endeavors in my life, and I wonder, do a lot of your ideas come from, some deficient thing you see in everyday life that kind of lights the fire for you?
Yes, absolutely. Supposedly necessity is the mother of invention. I would also add that probably nuisance is the father of invention. Because a lot of times it's just something super annoying that you're having to do and you're frustrated with and you're fighting. And, for me, again, early in my career, that meant, busted knuckles and scrapes and scratches and bruises and fatigue, and sometimes even injury. And that idea, that concept of, man, there's just got to be a better way. And really, until someone stops and kind of asks that question and, brainstorms, problem solves, works their way through a few solutions that might actually lead to that, we're all bumbling through doing that silly thing, that silly way. And a lot of times we look back on it, years later, we're like, wow, that was so obvious. Why didn't I think of that? Well, yeah, that is a question, I think, for all of us. And the person who did, they not only thought of it, but they did something with it, right? They took it to those next few steps. And so I think for my talk, that's one of the things I want to help people to understand, gain a little more knowledge about how to go from, I think there's a better way. I might even have a better way. What do I do with that now? How do I get that out to the world? How do I protect it so that I might be able to gain financially from it? And then how do I take that and get it commercialized? And so I'll walk them through some different scenarios of how they might accomplish that.
Gotcha. So from the idea to the full process of implementing.
Exactly.
Gotcha. Well, jumping into the AEC, the conference, what do you feel that you gain each year by attending AEC and being there with fellow ergonomists?
Yeah, great question. It's for me a way to kind of reset. So I go and I get the motivation. Of course, I pick up knowledge, but I get to also dial into some of those friendships and relationships in the field that I've had for over 30 years. Many of those people that I see every year are folks that I worked with in my first job out of college. And so it's exciting to just catch up and see what they're doing, see what kind of breakthroughs they're making, and what's happening with their companies. We love to go as a school because we take students. The students get to interact with the workers on the line who are coming to the Ergo Cup, but our students also get to interact with the professionals in the field, and they get to meet professionals who are at different levels throughout their career. And that's really helpful because one of the things that students struggle with is seeing themselves in other professionals. They don't meet enough of them and come across enough of them, in my opinion, to be able to picture themselves doing that work and being at that same place in 5 or 10 years. And so it's a really great conference to be able to do those things. Very few conferences out there combine the levels and variety of people, professionals, line workers that this conference does. So it's fantastic for all of that.
Gotcha. Well, I appreciate you taking a few minutes for me today.
Absolutely, Frank.
Thanks to our guest, Dr. Mark Benden. We hope you'll join us in person at AEC for cutting-edge sessions, hands-on workshops, and the Ergo Cup competition. And don't miss the Problem Solved live booth, where we'll be capturing insights from leaders shaping the future of ergonomics. Every great solution is a story worth telling.